Greetings from PediSTARS India. I'm Dr. Sujatha Thyagarajan. I'm one of the founder members of PediSTARS India and the current secretary. I'm also a lead pediatric intensivist based at Avi Hospital in Bangalore. I'm presenting on behalf of PediSTARS India, and I thank SSH for giving us this opportunity to share our journey of PediSTARS in India over the last 9 years. And the theme that is given to us is striving for excellence when starting a simulation program. So let me take you all on a flashback to a decade ago, how the progress of simulation was in India. So these were some of the things that we were being told. So what's simulation? Did you say stimulation? Are you saying we need to learn from mannequins? Why do we need mannequins? They're so expensive. This is India. We have real patients and we can learn from them here. And why do we need to waste our clinical time doing simulation, especially in the hospitals? And what about errors? Well, they're just a matter of really bad luck. So this was our scenario when we kind of proposed the thoughts for simulation in India. I'm sure many of you resonate with this, especially the countries where simulation-based training is still yet to start its roots. It's just a reminder for all of you who's about to start a program to just think about how to kind of get there. So we started by building the evidence for simulation-based training. So my colleagues, Dr. Rakshay and Dr. Gitanjali, conducted India's first pediatric simulation workshop in Hyderabad as part of the Pediatric Critical Care Congress that we annually have. And during their experience, when they conducted, they found that it was very, very difficult to get trainees to register. And we shared our experience as part of a poster that we submitted in International Pediatric Simulation Society workshop. I was working in Bangalore and I submitted a couple of posters of my experience of even working with a pillow because my hospital did not have mannequins. And needless to say, they found that it was difficult to accept without any realism there. And also, we had, but they did understand the concept of simulation, and they said scenario-based training, the residents rated them quite highly. We networked with various international agencies, and in 2013, we decided to form the society called PediSTARS India. This was, which is called Pediatric Simulation Training and Research Society of India, started as a self-funded society by just the three of us. My colleague there's Dr. Rakshay, Dr. Gitanjali, and then myself. And we were able to garner global support within the year. How did we do that? In collaboration with international societies through affiliations and agreements, SSH, IPSS, and Inspire. We thank Dr. Vinay Nadkarni to be the link for all of these agencies. Now that we formed a society, our next move was how to build this national momentum. We are just doing simulation in our center. Can we collaborate better and make it pan-India? That was our vision and dream. That's how we started in 2013. How did we do? We started countrywide workshops for emergency care. We focused on that. So we did more like targeted workshops. We innovated and had single day workshops such as STEP, NeoSim, Success, some various boot camps, SNAP workshop for nurses. Our lifeline is faculty development program, making sure that we have an adequate pool of simulation facilitators to facilitate these programs across the country. We have a simulathon, which is thematically based like a marathon of simulation across the country. And then we have our own annual conference, and we recently concluded our Simulus 7 at AIIMS Jodhpur. We have community-based simulation programs as well, which is called the ABC Active Bleeding Control Stop the Bleed program. And we continue with our collaborative research and low-cost innovation hackathon programs. Let me just tell you a little bit details about each of these. Our key milestones. So we started with propagating across the nation first. So we had a national outreach through various of our workshops. And recently we've started having global outreach, more of an international representation, more of research, which is multi-center. And I'm very pleased to say that PediSTARS members have started winning awards across international conferences. We have not stopped ourselves innovating even in telesimulation. We've recently formed a nursing special interest group, and we're scaling up our community ABC Stop the Bleed program. These are our activities across the decade, and we're very pleased to say we've conducted more than 115 workshops across the country, and we've managed to reach nearly 10,000 doctors and nurses and healthcare professionals. We started with 3 people, and now we have times 5, that is 15 board of directors across to manage the administrative functions of PediSTARS India and to form various special interest groups to help grow simulation across India. And we are very, very indebted and have immense gratitude to our international mentors. How did we do that? Without funds, without resources, and without even simulation labs. We did not spare any opportunity to reach whoever was interested in simulation in whichever place they were and however we can do it. It was just the sheer determination to make it happen. And we didn't spare any space, including hotel auditoriums as well. And our Lifeline faculty development program, let me tell you very clearly, to spread simulation, we need faculty. It's not possible to have a small core team to spread simulation across the country. So we were very lucky to have our international mentors who spared their time, their resources, their funds to come visit us every year and help us reach out and train the faculty. So we are very, very lucky that way. Our faculty development program has happened and evolved in collaboration with Children's Hospital of Philadelphia, Boston Children's Hospital, Starship Hospital in New Zealand. And we had a very good buy-in from our senior educators across the country. We now have trained faculty who have joined the National Pool of Simulation Facilitators, and they are helping us to disseminate the SIM programs. Let me tell you a little bit about our 3-tiered faculty development program. The structure, in level 1, it's a 2-day workshop where there is a hands-on experience of getting to know the nuts and bolts of simulation, and it's a 2-day hands-on intense workshop with an attendance and a certificate. In level 2, over the next 6 months, they need to go back to their own workplace, and we share with them standardized scenarios that they are supposed to conduct in their workplace and then get reflections and debriefing done with their own assigned mentors. Please remember, this is like open to the PediSTARS members, and all the mentors work for free. And in the next 6 months, we have 3 projects in the level 3, emphasizing mainly on the research aspect of it and their own conduct of simulation. And this is also, once again, reflections, debriefing, and portfolio done with the mentors. Our PediSTARS workshops have been very popular over the last few years, and you can see the growth. Nearly 80 participants every year get trained, and our nursing numbers have also started increasing. Let me tell you a little bit about the simulathons, the period prevalence across the nation that we conduct. We've had various themes, as you can see, mainly on resuscitation, trauma, sepsis, communication training, telesimulation, and last year on COVID-19 preparedness in 2020. About a little bit on how do we do our simulathon. So the core team does the needs assessment and picks up a theme, creates scenarios, identify all the facilitators, then we prepare them through our WhatsApp group. We share various ideas on how to actually conduct this simulathon, and then we do the running of the scenarios. We share the summaries in the WhatsApp group about our learning points, identify those system changes, which is fed back to the core team to deliberate on how to make things better. So this is our preparation of simulation, and then conducting the simulation, and then collecting the system changes post debriefing, and our experience of reaching out to as many as possible. Over the last year, we've been starting to work with our nursing leadership because they are key to providing that care to the children. And our joint secretary right now for PediSTARS, Ms. Smita Das, has been awarded the scholarship, which is the PediSTARS Sejal Dalip Kulkarni Nursing Scholarship for the last year, and to get CHSE SSH membership as well. So we thank Pooja Nawate for helping us with this. Our ABC Stop the Bleed program is a collaborative effort with various agencies, including CHOP, where volunteers are trained to provide the care of stopping the bleed. And in September 2021, we launched it even for the schools. How do we build the momentum otherwise? More so, creating stakeholders' awareness in journals, textbooks, and magazines, through symposiums, and through international representations. I'm very pleased to say that our telesim project has actually started reaching that child as well, and we have demonstrated the improvement in the care given to children with sepsis through our project, award-winning project from CMC Vellore. Our PediSTARS telesimulation journey during the COVID time has been immense to reach the unreached. We have turned this adversity into an opportunity through collaboration and through creative innovation and through community building. All our work has recently been recognized across the world. We started with our SSH President Award in 2018 to actually winning the Inspire Research Award in 2019 and 20. We've won the Cornell International Telesim Conference Award and the best presentation in the IPSS as well this year. Our work continues. The future, what can we do better? It's important to sustain partnerships and collaborations across simulation societies in India, various professional bodies, learn from each other, have roundtable meetings wherever possible, and work with our agencies to get formal accreditation. Our journey for striving for excellence continues, and I'll be very happy to take any questions. Thank you so much for the opportunity to share our journey. And I hope it inspires many countries that are willing to set up another PediSTARS in their own country. Thank you so much.